Good evening, everyone. Thanks so much for joining tonight's Teletown Hall with Congresswoman Lisa Blunt Rochester and Dr. Karyl Rattay, Director of the Delaware Division of Public Health, to discuss the coronavirus. My name is Jacqueline Sanchez, and I'm Congresswoman Lisa Blunt Rochester's Chief of Staff, and I will be moderating tonight's Teletown Hall. While we wait for people to dial in, a few important notes. If you'd like to ask a question, please press *3 on your phone, and you will be connected with a member of our team to take down your question. If you'd like to opt in to receive the Congresswoman's newsletter, please press *6. If we're not able to get to your question tonight, you will be able to leave a message at the end of tonight's call, and we will post a frequently asked questions resource on our website. So again, if you'd like to ask a question, please press *3. And if you'd like to opt in to receive the Congresswoman's newsletter, please press *6. We'll be right with you in just a moment. Thank you. Hi, everyone. Thanks so much for joining tonight's Teletown Hall with Congresswoman Lisa Blunt Rochester and Dr. Karyl Rattay. We're just waiting for a few more people to dial in, and we'll get started in approximately 1 minute. My name is Jacqueline Sanchez. I will be moderating tonight's Teletown Hall. A few important notes. If you'd like to ask a question for the Congresswoman or Dr. Karyl Rattay, please press *3. And you will be connected with a member of our team who can take down your question. If you don't get a chance to answer your question tonight, if you don't get a chance to have it answered, you will be able to leave a message at the end of tonight's call. So please stay on the line, and we'll be sure to post a frequently asked questions resource on our website. Thanks, and we'll get started momentarily. Hi, everyone. We're going to get started. Again, thank you for joining tonight's Teletown Hall with Congresswoman Lisa Blunt Rochester and Dr. Karyl Rattay, Director of the Delaware Division of Public Health, to discuss the coronavirus. My name is Jacqueline Sanchez, and I'm Congresswoman Lisa Blunt Rochester's Chief of Staff, and I will be moderating tonight's Teletown Hall. If you'd like to ask a question tonight, please press *3, and you will be connected with a member of our team to take down your question. If we're not able to get to your question tonight, you will be able to leave a message at the end of tonight's call, and we will post an FAQ resource on our website. So for now, I'm going to turn it over to Congresswoman Lisa Blunt Rochester to provide a few remarks.
Thank you, Jacqueline. Good evening, Delaware, and thank you for joining us on this important call. First, I'd like to express our care and concern for those who have contracted the coronavirus. For those of you who are concerned with your own health or that of your children or aging family members, and for those of you who are also concerned about your job or your small business. While these are challenging times, we will get through this together. And on behalf of myself, Senators Carper and Senator Coons, who have representatives on the call, we want to convey our deep gratitude to those of you on the front lines protecting and serving our state and our communities now and every day. As many of you know, I am on the Health Subcommittee of the House Energy and Commerce Committee. And tonight, with a focus on health, our objectives for this call are really threefold. One, to give you a public health update from Dr. Rattay. And as you all know, this is an ever-evolving situation, so she will answer your questions and share what we know today. Secondly, give you information on what we've done in Congress. And third, to take your experiences and your ideas back to Washington as we develop the next legislative package and work with federal agencies. And as Jacqueline has shared, if we're not able to get to your questions tonight because there are hundreds of people on the call, you will be able to leave a message at the end of tonight's call, and we will post a frequently asked questions resource on our website. So for the update from Congress, in the House, we passed two bipartisan packages. You may have heard about it on the news. We passed H.R. 6074 first, and that was the Coronavirus Preparedness and Response Act. And that was an $8.3 billion package. $4.5 million of that was designated for Delaware, and will fund vaccine research and development. It will expand telehealth services in Medicare. It's for equipment like face masks, and it will also provide low-interest loans for small businesses. That bill actually passed, the House passed the Senate and was signed into law. Early Saturday morning, the House passed the Families First Coronavirus Response Act, and that bill actually was also bipartisan, and it passed 363 to 40. That funds free testing, paid emergency leave, enhanced unemployment insurance, and increased funding for food security and protection for frontline workers. We are currently waiting on the Senate to take that up, and we have been told that they are going to take it up quickly, so we're hoping that it happens in the next day or so. There are also proposals for a third package being drafted both in the House and the Senate, and the administration also has proposals. So again, your input, the conversations that we've had with Delaware stakeholders is going to be very important as we go into the next package. So the delegation will continue to advocate for the resources and the flexibility that we need to protect our health and the health of our economy. And I also want to reiterate that as the situation evolves, we want to give you the most up-to-date information as possible. I know Dr. Rattay can speak to the state resources we have available, but from the federal perspective, you can visit cdc.gov/coronavirus for the latest recommendations and guidelines from our federal public health officials. Thank you for joining us, and I will now turn it over to Dr. Karyl Rattay, the Division Director for the Delaware Division of Public Health, who has been working tirelessly on this effort. We asked if Dr. Rattay could give us a brief update.
Absolutely. Thank you so much, Congresswoman, for the opportunity to be with fellow Delawareans tonight. This is a challenging time for many people. We're in uncharted waters in many ways. Most of us have never experienced the closure of so many establishments around us. I have to say, to start with, I am so heartened by the coming together of Delawareans in response to COVID-19 in our state. Here at Public Health, we have been planning for a pandemic response for years, and although this is evolving and there's many unknowns in the situation, I am seeing state government staff, staff in our department and the Division of Public Health, along with our many partners across the state, coming together to solve problems. And when I hear about some of the challenges in our other states that my other colleagues are dealing with, I'm just so proud to be a Delawarean, and I'm very proud of the way we are coming together. But that's not to say that everything's perfect and everything's been smooth along the way. We know that all of you have questions and concerns. I know there's things that maybe we haven't been able to get up and running fast enough, or that people have spent more time than they've wanted on our call center. My hope is through this and many other opportunities that we can answer your questions, as that is so important to us, and hopefully get your feedback, and also how we can improve our response. As you probably heard, we had an announcement today of 8 additional positive cases. So in Delaware, we've had 16 positive cases. 15 of those cases are our Newcastle County residents, and we've had today our first positive case reported in Sussex County. All of these individuals are self-isolating at home, except for one individual in Newcastle County who is hospitalized. Most of these positives today, I want to mention, have come through both the Christiana Care event as well as one from the Sussex County event. But if I saw some of the questions already, I think it's important for folks to know that many of the labs from those events still are pending, meaning we don't have the results of all those labs yet. So both Christiana Care and BV, who are the ones who ordered those labs, who ran those events, will get those results, and then they contact us when they get those results. Specifically, they let us know when there are positive cases, and then our public health folks reach out, make sure people have the information they need, and also help those individuals to reach out to their contacts to let them know if they should be quarantined. But for all Delawareans right now, it's really important that people do practice social distancing, which I think we'll probably talk a little bit more about. But really this means keeping at least 6 feet apart from individuals and finding alternative ways to greet people, so don't shake hands with people, and also practicing good hand and cough hygiene, which I'll talk a little bit more about. We are especially concerned with individuals who have an elevated risk, and that includes individuals who are over the age of 60 and individuals with chronic underlying health conditions. And so we do strongly recommend individuals in those higher risk groups, please stay home as much as possible. Now, I say that, but I do want to say, if you want to go for a walk on the trail, as long as you stay away from people, we're not saying that you must be in your home if you're in the high risk every second of the day, but what is most important is that you do stay away from people as much as possible, at least 6 feet away from people. For any individual who is sick, and the symptoms for COVID-19 are fever and either cough or shortness of breath. So we are very specifically looking for these symptoms of fever and cough or shortness of breath. Individuals with these symptoms must stay home. The best thing to do if you have these symptoms is call your primary care provider and get guidance about what the next steps are for you. Testing for coronavirus is in high demand right now, and it's really important for people to know that the strong recommendation is only those with those symptoms of fever and cough or shortness of breath are to be tested. The test is really not valid for those who don't have symptoms. And although we have a lot of requests from people who are worried, it really is not appropriate to test people who don't have the symptoms at this point. There are many more opportunities for laboratory testing now in this state, and we thank our congressional delegation for their help in increasing access through commercial laboratories. So a number of commercial laboratories can do testing now, which is really fantastic. We have a public health laboratory that also does testing, but our testing is really intended to be for the highest risk individuals in which we need, quick turnaround to determine actions. I think it's really important for folks to know that one of the reasons why we are all so concerned about this novel virus is because at this point there is no vaccine and there are no known effective antiviral treatments. All of that is in the works. There are antiviral treatments that are being tested, and certainly an aggressive pathway to try to get vaccines out there. But we expect it to be quite some time, probably about a year before we have vaccines. Probably the most important message I can give folks is to make sure that you do hand washing as much as possible. Warm soap and water, sing happy birthday twice. I know you've all heard it, but I have to repeat it because it is so important. Of course, hand sanitizer helps. Hand washing is the best. Also, don't touch your face. I know you've all heard that, but it's really important. Don't touch your face. Clean commonly touched surfaces as much as possible. Stay away from people who are sick. And of course, if you do cough or sneeze, do it in a tissue and then clean your hands, or you can do it in your inner elbow. And of course, don't shake hands. So finally, I just want to make sure everyone has the information about our call center, which is 1-866-408-1899. And additionally, we have an email address, dphcall@delaware.gov. And also, we are continuously updating information, including our number of cases, on de.gov/coronavirus. And with that, I'll turn it back over.
Thank you, Dr. Rattay. Oh, go ahead.
Sorry, Jacqueline, this is the Congresswoman. I just wanted to say, since we jumped on the line when I initially got on, there were hundreds. There are now over 10,000 individuals that are on this call. And so, we won't be able to get to every question, but we're taking those questions, and we will be doing an FAQ, and we will include this information that the doctor just gave in terms of how to reach out to public health. And I'll turn it back over to Jacqueline.
Great. Thank you, Congresswoman. So our first question comes to us from online, and Adele asks, are there any restrictions on elective surgeries at this time? Dr. Rattay, can you speak to that?
Sure. So at this point, the Division of Public Health has not advised changes in regards to elective surgery, but we know that some hospitals, surgical centers, and even dentists are considering discontinuation of elective surgeries. We know some have already begun to implement this. This is really important for two reasons. One is it helps protect both healthcare workforce and individuals getting those elective surgeries to keep them out of the healthcare system right now. But it also helps keep the healthcare system open, less busy. And that's really important if and when we begin to see more individuals requiring, for example, emergency departments and hospital beds and ICUs.
Great. Thank you so much. Our next question comes from Norma. Norma wants to know, are Delaware schools closed?
Sure. So as of last Friday, the governor directed Delaware schools to close for 2 weeks. Now, the main reason at that time was hearing from superintendents that there really was a need for planning to prepare for a longer-term closure. And so it wasn't necessarily, as the Centers for Disease Control and Prevention guidance says, you should close schools when there's widespread infection, because we're not seeing community infection spread, but schools now are working hard to prepare for the time when we expect there to be widespread community infection, and kids will have to be learning at home.
Great. Thank you so much. Our next question comes from Margaret from Bear. She wants to know, why is it that the magic number of days for a quarantine is 14 days?
That's a great question. So the incubation period for coronavirus in general, there's multiple types of coronavirus, and so people have been looking at this for a while. And COVID-19 appears to have a pretty consistent incubation period from 2 to 14 days, meaning if somebody's been exposed, they could be contagious between 2 and 14 days after exposure. That being said, most people become ill about 5 to 7 days after exposure. Nonetheless, to be on the safe side, we ask for a quarantine or isolation for the full 14 days so that other people don't become exposed.
Great. Thank you so much. Our next question is from Peter from Bear. He wants to know, is there any consideration at the federal level to deploy military medical assets across the country? Congresswoman?
So at the federal level, there actually have been conversations about not just deploying individuals, but also about the stockpile of information, of materials that we have. And we actually had a letter to the administration to encourage the president to look at the defense of what's the name of that act? It's an old act that has been used. It's that we're working with the Department of Defense to get them involved, but there's an actual piece of legislation that allows us to be able to manufacture things. Like, so for example, we know that we've heard about a shortage of respirators and ventilators, and so one of the challenges that we've had as we've looked at this virus is the fact that we're dependent on supply chain outside of our country. And so part of our goal is to look at, can we manufacture things here, but also can we deploy resources here as well. I know even the governor is looking at how we would use the National Guard if necessary. If we need to have surge facilities that are built because we don't have the capacities in our hospitals, these are all the things that are conversations that are happening across the country.
Thank you so much, Congresswoman. Great questions, and thank you all. And a reminder, you can hit *3 to ask a question. Our next question comes from online. It's from William. William wants to know, what is the latest guidance on using cash or currency and our U.S. Postal Service mail? Is there a risk?
Yeah, so this really goes to the question of, does this virus live on inanimate objects? And that's one of the things that our colleagues at Centers for Disease Control and Prevention are looking at closely. You know, there is thinking that the virus can live on some objects for perhaps a day or so. For those who are handling cash on a regular basis, it's a good idea to use gloves, but also really good hand hygiene. But in general, it is felt that things that go through the mail are safe to open, and you should not be concerned about touching it.
Great, thank you so much. Greg from Newark wants to know, when will we see the results of these tests that were administered during the events, and how are they appearing in the official totals? Are there any plans to repeat the drive-through testing, but in all 3 of the counties?
All great questions. So the 2 events that were held by Christiana Care and BV, and there's actually one by Bay Health tomorrow. Since those health systems are the ones that ordered the test, they received the test back. A number have come back, but there's also still a number that are out there. When they get the results back, they contact the Division of Public Health with positive cases, and so then we do our job and follow up. So of the 16 that were announced today, we're at a total of 16. Of the 8 that were announced today, several came through, 7 came through the Christiana Care drive-thru, and 1 came through the BV drive-thru. But again, there's still results that are out there pending. And but for anybody who went through that event, you should be directly contacted by either Christiana Care or BV with your results. To answer, and I would like to try to make this a short answer, but I think this is really important. We have such an amazing healthcare system in Delaware, and our healthcare partners are really eager to step up and be a part of the solution and want to ensure that all Delawareans that need testing have testing available. We had a great conversation with them today, and they're all looking at how they can make testing available all the time, not just through these drive-through sites. So you may see more drive-through sites, drive-through events, which can serve a purpose, but what really is needed in our state are some stationary testing sites throughout the state so that people can go 7 days a week to get testing. And that's what we're working on hard with our healthcare partners right now.
Wonderful. Thank you so much. Okay, our next question comes from Janine. Janine is the parent of an evacuated Peace Corps volunteer due to arrive this weekend. She's been told he will be quarantined at home, and she's wondering, how does this affect other household members?
So we have guidance on our website, de.gov/coronavirus around quarantine. We advise anybody who is to be quarantined to take a look at that. You really want to have a separate space away from others in the home so that they are not exposed.
Great, thank you so much. Our next question comes from Joe from Rehoboth Beach. Joe wants to know, because the virus is moving so quickly, is this an airborne virus?
So scientists have been looking at that, but it is really felt to be spread through droplets and not airborne. And that is why so much of our guidance is around, staying 6 feet away from people, washing your hands, covering your coughs, because it really is spread from droplets from one person to another when they cough, sneeze, or speak. So at this point, we don't think that it has airborne spread.
Great. Our next question comes from Ramondo from Bear. He wants to know, how vulnerable are people with youth asthma? So young people who have asthma, are they at a higher risk? Dr. Rattay?
Yeah, so it's really interesting, this virus, that younger individuals are really faring quite well with this virus. And even those with underlying conditions who are younger, so children and adolescents tend to do much better than adults. Nonetheless, asthma is considered a risk factor for more severe consequences from COVID-19. So we would include a child or youth with asthma as in that high-risk group, and they should follow those recommendations.
Dr. Rattay, this is the Congresswoman. Just to follow up to that, the issue of people being asymptomatic and whether or not they can spread the disease, could you talk to that, to the virus?
Yeah, Congresswoman, that is a trillion-dollar question, quite frankly. There has been seen some asymptomatic spread of the infection, but at this point it is thought to be relatively rare. And part of that is because asymptomatic people don't cough, and that is the primary way in which it is spread. Nonetheless, again, there are some examples of asymptomatic people who have spread the infection, and that is part of why the mitigation strategies, the strategies of closing, the many places that we go to in public will make sense and will make even more sense as we go forward.
Thank you, and that also reinforces the piece about social distancing. Please, everybody, pay attention.
Great point, Congresswoman. So our next question comes from Deborah from Lewis. She wants to know, if I become sick, do I have to call an ambulance, or what's the procedure?
Great question. For anybody who's ill, if it's not emergent, in other words, if a person is not having significant trouble breathing and wouldn't otherwise call 911, there's no need to call 911 or activate the emergency medical system. There's also no need to go to the emergency department. In fact, it's really important to keep as many people out of the emergency department as we can right now. The best thing to do if you develop those symptoms of fever and cough or shortness of breath is call your primary care provider. If you don't have a primary care provider, give our call center a call, and we can talk you through the next steps.
Dr. Rattay, can you provide that call number one more time while folks are listening?
Yes, absolutely. It's 866-408-1899. And then again, not for someone who's ill, but anyone can email us at dphcall@delaware.gov.
Great. Thank you so much. Our next question comes from online. Margaret wants to know, there's almost 1 million people in Delaware. So she's wondering how many test kits are available for all of these people. Dr. Rattay, can you speak to the latest?
Yeah, so the test kit availability has increased significantly over the past couple of weeks. A number of commercial labs like LabCorp and Quest and others now can do the testing. And so there's really no set number for test kits that are available to Delawareans. We can do as many as are absolutely needed. I will tell you, though, there is a little bit of a shortage right now of the swabs that are used to do the testing, and that is something that we are working on. But for Delawareans who do need to be tested, that access is available.
And could I just add to that, for those of you who are listening, the congressional delegation has been on conversations with the governor and the Department of Health and Social Services here and also other stakeholders throughout the state to find out what kind of equipment and things that we need, particularly, the gear that folks have to wear. We want to make sure that we have the professional, protective equipment that they need. And so this is something that Senator Coons is an appropriator. He's on appropriations. All of us are working very hard in partnership with the state to make sure we have the resources we need. In addition to that, the director, as she mentioned early on, in the beginning, states had to have at least 5, I think it is, presumptive positive tests in order for them to then go out to private labs. Otherwise, it had to be done through public health and sent to the CDC. And Doctor, I think that also, now we have the ability to have the private labs involved, so that also increases capacity, correct?
Absolutely.
Wonderful. Thank you. Our next question comes from Judith in Millsboro, and she wants to know, is there a vaccine being developed, and is there any federal funding that is helping?
I know Congresswoman Blunt Rochester has been involved on the federal side of getting funding for it. I can talk about from the scientific side. There are a lot of folks working on the development of a vaccine. I think we're all eagerly awaiting a vaccine, but the reality is, because there's been no coronavirus vaccine that's been in use in the past, that's been found to be successful, this is going to take a little bit longer. So we are really expecting that it's going to be at least a year before we have a successful, effective vaccine available to Delawareans.
And I would just add that in that first package that we talked about, the Corona Preparedness and Response Act, that provided $3 billion for vaccine development. And as was said, and as many of us have heard from Dr. Fauci and others, it would be about 12 to even 18 months. But I know that folks are working expeditiously. But we appropriated $3 billion for vaccine development.
Thank you. Our next question comes from Joan. And Joan wants to know, is there testing in the Walmart lots in Rehoboth Beach? I think we've heard the president mention that some companies would be rolling out testing in their lots. So she wants to know, is that available in Rehoboth Beach? If not now, when will it be? And if not in Rehoboth Beach specifically, where should folks go for testing in Sussex County?
Yep, great question. So as I mentioned before, we are really working hard with our health care partners, with the hospitals across the state for testing access. and there will be more of these stationary testing sites available over the next few days and weeks and months, and we will be pushing that information out to all of you sooner versus later. I think that the president was probably talking about one of the drive-thru types of events, perhaps in a Walmart parking lot. Those don't exist here in Delaware right now. We don't see that as a sustainable approach to make testing available, but in some communities, you may see more of the drive-thru events as needed.
And I would just add, in that first package, we also included $100 million in emergency funding for community health centers, because they are also a part of our healthcare network here in Delaware.
Great point. Our next question comes from Ted. Ted would like to know, has there been any research that connects the coronavirus and other viruses that you usually get the flu shot for? Dr. Rattay?
I'm not quite sure I understand Ted's question. The coronavirus is definitely very different than influenza for a number of reasons. I'm not quite sure of. There's not really any specific connection between the two viruses. They have some similarities in symptoms. I think influenza is unique or different in that there's a vaccine and antiviral treatment, and unfortunately, as we've talked about, there is not yet for COVID-19.
Thank you. Our next question comes from Sue. She says that she saw that New York is considering shelter in place, and other places across the country are doing that. If Delaware does that, how do people get groceries or prescription medications? Can you speak to that and whether that's something the state is considering?
Yeah, I mean, as we go into the upcoming weeks and months, there will be, a lot of reevaluation depending on the situation, depending on how widespread infection is, how severe the illness is among our Delawareans, and also, are Delawareans abiding by social distancing? Are Delawareans, those who are at highest risk, are they staying home and staying away from others? I think we all have a role in protecting ourselves and others, and I think everybody stepping up right now can help prevent us from having to take, really rigorous measures in the future. That being said, we hope that, pharmacies and grocery stores are able to continue to serve people, but we strongly recommend, everyone start looking at delivery options for whether it's a supermarket or food, or there's a lot of delivery opportunities now to think about.
Great points. Thank you so much. Our next question comes from Carla from Newark. She would like to know about telemedicine. What's being done on telemedicine to address the coronavirus?
Well, if I could just jump in on this one, the President's emergency declaration actually waived some of the laws and like certain federal licensing requirements so that we could more broadly expand the use of telehealth and telemedicine. We have a lot of folks that would show up in hospitals or doctor's offices, and we really want to minimize that. And so by being able to have folks do this remotely, that will be able to help free up some of the healthcare pipeline. And then in addition to that, just the ability to have doctors from other states be able to provide services will also be something that will be helpful. So there was the declaration and also funding. This was also part of our preparedness package as well. Dr. Rattay, I don't know if you'd like to talk a little bit about telehealth here in Delaware.
No, I think you said it all. I mean, I think this is actually a time when we're going to really be pushing to a different kind of delivery of healthcare services. And I am really grateful to the federal government, our federal partners in Congress for helping us move some of these pieces forward.
I would just also add to Delawareans that one of the major conversations that we've been having, and now this has heightened it, is the whole issue of access to broadband, whether you're in a rural area or whether you're in an area of our state that's spotty. We know that as more people do telemedicine, as more people are doing telecommuting and working from home, or even children that are being schooled, we need to make sure that we have access. And so I know the governor has put a high premium on that as well, but that's something that has become very evident as part of this process.
Thank you. So our next question comes from Rod. Rod would like to know, I have no symptoms, but I want to get tested as a precaution. Is it possible to get tested without symptoms?
Thank you for asking that question. That is a question that we get a lot. And the test is not approved or valid for people who don't have symptoms. So we know that there's a lot of people that want to get tested just to know. But for those who are exposed and who may actually be developing the infection, if you don't have symptoms, it's very likely that you will be negative one day. And if you develop symptoms the next day or 2 days later, then your test may turn positive. This can give people a false sense of security in thinking that, well, now I have a cough, but I don't have it because I tested negative. So again, not only is the test not approved or valid for people without symptoms, it can be very misleading, and so it is not recommended at this time.
Thank you. So our next question comes from Lee. Lee wants to know, so many people are being laid off. Is there any kind of movement toward getting funds to those who are in need?
Hello. Yes. Hi, Lee. There are a lot of pieces to this. Number one, in the bill that we just passed, there is a focus on emergency paid sick leave, in addition to that would be for 2 weeks, and that would be for employees at companies with fewer than 500 employees. Then we also have a FMLA, the Family and Medical Leave Act, that would be expanded as well for those companies with 500 employees or under. This is part of the bill that is now in the Senate that we're waiting to see what happens with that. But we also know that there are people that are going to have other challenges. So, for example, I've called for a moratorium on foreclosures and evictions. We've also, said that, people who have utility issues, that, we need to be mindful of the fact that people's utility bills need to be paid as well. And then there are small businesses that are going to be impacted, and whether they can apply for a loan, but if you don't have the cash flow to be able to sustain you, that could also have ripple effects in terms of, people being let go. So we're trying to look at all of this in this Families First Coronavirus Response Act, and you will see more upcoming changes as we go through this week with the third package that we're looking at. So again, all of your comments are really important, and we're taking those all back with us to Washington.
Yeah, really great question. Anne wants to know, Anne is our next question. She says, we have a list of volunteers who are willing to shop for local neighbors who might need assistance. How do we connect with people who might need help? I'm going to turn this one to Dr. Rattay if you have any suggestions for Anne.
So I know that there are a number of amazing people in Delaware across our department, across our nonprofit sector, the food bank, and many others who are working on this. And there are a lot of organized efforts to help support kind of matching people who want to volunteer to some of the opportunities. I we will need to follow up with you on more details about how to get engaged. But I will say there is, for those who are interested in helping out, there are plenty of opportunities right now, and we'll make sure we can get you connected.
Yeah, I would just add that on one of the calls that I had earlier today, one of the things that this has shown is that it's not just public and private sector, but the nonprofit sector plays a huge part. And there is an interagency group that is working across the state that has representation from Bernice Edwards down in Sussex County to Paul Calistro and the United Way and others that have come together and are trying to, number one, understand what those volunteer opportunities and needs are, but also, and this is where we talk today about partnering with public health to find out how to volunteer in a healthy way. We want to make sure that people are safe as they are trying to do these good deeds. So this was one of the questions that came up earlier today, and I think you will see as a state some conversation about how to do that best. As was mentioned, the food bank is also looking for volunteers as well. So there are a lot of organizations that are doing that. But I think what we're going to do is talk about how to be able to do it in a way that is very safe.
Thank you, Congresswoman. These are all really great questions. And we're about at that time where we only have time for one more question. So like I mentioned, we had so much interest, and I know there are so many questions out there, and we didn't have time in this hour to answer all of them. But we do encourage you to stay on the line. You can leave a voicemail with your name, your phone number, your email address, and your question. We're going to sort through all of those and then put together a frequently asked questions on our website, which is bluntrochester.house.gov. So if you go to the Congresswoman's website, we will put together a frequently asked questions document trying to get at, most of these questions that you guys are bringing to us. But you can also call the Department of Health and Social Services at 1-866-408-1899 with specific questions about the coronavirus. So some of these questions of should I get tested or where are the sites, those would be great questions to direct to DHSS. And so now I'm going to turn it over to our final question for the evening, and then we'll turn it back over to the Congresswoman and Dr. Rattay for a few parting words. So William from Milford would like to know, is the IRS going to extend the tax due date? Congresswoman?
It's a great question, William. We just heard today during a White House briefing, the Treasury Secretary, Stephen Mnuchin, say that the filing deadline is going to remain April 15th, but they'll provide a 90-day grace period to pay any taxes owed. And that period applies to taxes of $1 million for individuals and $10 million for corporations. So again, the tax filing deadline is the same, but the grace period for paying would be a 90-day grace period. Also, while in line with that, I would also encourage people to still do your census. You can do that online. I know I received my packet in the mail today. Take that opportunity because that means representation for Delaware, but it also means appropriations. It means dollars for roads and all of the bridges and schools and everything that we need. So please take the opportunity to do that as well.
Thank you so much, Congresswoman. And thank you all so much for the great questions. Again, please remain on the line. Leave us a voicemail with all your contact info and your questions, and we will put together a frequently asked question document on our website. And again, the number for DHSS is 1-866-408-1899 if you have specific questions about the coronavirus. But now I'm going to just turn it over to Dr. Rattay. If you don't mind just providing folks with a few closing thoughts, any advice for people?
Yeah, absolutely. So again, I really want to say thank you so much to Congresswoman Blunt Rochester for this town hall tonight, and everyone for joining. We know that it is a challenging time, and we know that you're hearing about coronavirus everywhere you turn, and there's some accurate messages out there, and there's some messages that aren't so accurate, and so we really want to encourage you to stay tuned in to credible sources of information. At our de.gov/coronavirus, we are working to keep that information updated about what's going on in Delaware on a regular basis. The Centers for Disease Control and Prevention also has some great information. We look forward to working with the Congresswoman's office to help answer the rest of the questions that we weren't able to get to today. But don't hesitate to reach out to us at either email dphcall@delaware.gov, or again our number 1-866-408-1899 to talk to somebody. Thank you so much.
Thank you.
And
thank you, Jacqueline, so much for doing this, for moderating. I want to thank all of the Delawareans for such incredible questions that you asked, and a special thank you to Dr. Rattay for taking the time and for the work that you do, for the public service that you provide. We know that this is an important issue because just now we've had on this call 13,997 people. And so we know that you recognize how important this is, and that as a country and as a state, we're going to get through this. But I think it requires two very important things. One, that we take care of ourselves and our family and friends and coworkers, and two, that we take it seriously. To the extent that we take this seriously, we will find our way to beat it. And so I just want to, again, thank you so much for taking the time. Stay connected to us because this is ever evolving. And on behalf of my team here, on behalf of our senators, we just encourage all of you to be well.